So the National Department of Health has expressed concern at the alarming number of adolescent pregnancies in the country. On Christmas Day alone, more than 100 teenagers under the age of 19 gave birth, with the youngest being 13. Latest data, or rather data from Statistics SA from March last year, shows that more than 90,000 girls aged between 10 and 19 years gave birth between March 2021 and April 2022. We speak to the Deputy Minister of Health, Dr. Sibongiseni Dhlomo, on this. Thank you very much, sir, for your patience with us. What should this tell us, that more than 90,000 girls between the ages of 10 and 19 gave birth?
Thank you very much, and good afternoon to you, President, all the viewers of Newzroom Afrika. No, it actually confirms this as our area of focus in the Department of Health, not only just health, but as a society. It actually says to us there's about 50 teenage mothers who give birth every day in South Africa, and at least a minimum of 50. Now, we would therefore want to deal with those multi-pronged causes, and starting with those that are very glaring and obvious to ourselves. When we have a countrywide dialogue with the young people, they point some of them fingers and criticisms to us as a Department of Health by saying, but I should have been assisted last year. I felt pregnant because when I went to the clinic, I was given a very bad attitude by some of the staff members. And they're saying, instead of us welcoming, so we are changing the narrative to do it, to say, can we then not look at it differently, to say, here is this 17-year-old, a very responsible young South African who says, I am now sexually active. I want to finish my matric before I fall pregnant. Can you assist me? Instead of saying to them, go away, we don't have such facilities, we are too young, this is not possible, we need to then embrace them. So over 2,000 health facilities in the country have embraced this program called a youth user-friendly service by creating what we call youth zones. Per clinic, we create a space, a room, or maybe an adjacent building across the street where we meet young people, a dedicated nurse who has been trained on these programs to really be user-friendly to them, and also pretty very cordial to say, thank you very much for being responsible. Come in, let us assist you. We will take you through a process that will allow you to not to fall pregnant or make someone pregnant. Now, there are other factors that are there to do this, but let's start with those that are pointing fingers to us as a department and see where we can improve and reduce unintended pregnancies, unwanted pregnancies, teenage pregnancies, and even termination of pregnancies in a very illegal way. Because if we don't assist them to give them a way this is a way to avoid pregnancy. If they do fall pregnant and probably want to terminate their pregnancy, they won't even come to us, and therefore then we have another escalation of illegal abortions through these quick abortions, safe abortions by these very crude people that are putting posters all over our country. So it's a multi-pronged approach that we want to adopt, of course, with other departments supporting us, including should we or should we not report teenage pregnancy as a rape, a 10-year-old, a 13-year-old, what do we do? So all those are challenges that we are faced as a society.
To your point of whether reporting a 10-year-old being pregnant as a rape or not, the people that are engaging with these young people, what are we finding? How old are they? Is it children who are engaging in activity with children, or is it a mix of children who are engaging in this kind of activity with older men?
We recall that because of physiological changes in both men and women get mature, they get to puberty much earlier than men. So a 10-year-old boy is unlikely to be able to make someone pregnant. It is obviously an older man, an older boy, probably 18 years old, who would make this a 10-year-old pregnant. Sometimes it is much older. That is why we also want to say this age gap is a sugar gap. A 28-year-old man having a relationship with a 13-year-old is already very something that we need to be very frowned upon. It is a space we talk about sugar daddies, because you don't have to be as old as myself, but you just have to be much older. A 28-year-old having a relationship with a 10-year-old is just not morally correct. But we also want to say to ourselves, well, some of even the 17-year-olds have a relationship with older men, to say, what is it that tells me I should be so protective of my 17-year-old daughter, but I should shy away from protecting another 17-year-old daughter from another family? Can't we improve our moral compass as citizens, as men, so that we should not be able to say, I provide support to this and that girl, in return I have sexual favors for them. So those are things that talk to issues that are societal, so that is bigger. Sometimes this 10-year-old is now pregnant, and therefore you try and get social workers to come in and intervene, and that family says, no, don't worry, Duduzile's father is already paying lobola this side, so it's our own internal family issues, don't come into that space. So it is a societal discussion that must be taken very seriously, obviously probably assisted by faith-based organizations led by the religious leaders together with the traditional leaders, who must really come into that space to guide and support this moral upbringing of men to actually not abuse women the way it does. But let me just hasten to say, in 2016, because we were seeing an upsurge of this teenage pregnancy, there was a launch in the country of a campaign called the She Conquers. We were coming in to say to the young girl, can you be a conqueror? Try under all adversities to conquer the situation wanting to abuse you. Prioritize yourself. I want to finish matric without falling pregnant, without HIV infection, without sexually transmitted infection. So let me then look for resources that are going to assist me as a conqueror. And the campaign we call She Conquers. So a lot of those campaigns assisted us in really taking this increasing awareness and support from this platform that you are also engaging us. Is calling all of us as South Africans. What role can we play, not only in my house, in the society, but in the whole country, regarding support to these young girls to really mature and get to pass matric without really getting to this trap of falling pregnant too early.
Dr. Dhlomo, how effective have these campaigns been, in particular this Conqueror campaign? We know that South Africa is dealing with an issue of child-headed households, and so when you speak of these societal issues where young girls then offer themselves at the altar of an older man who has some money so that they're able to put food on the table for either their siblings and, at worst, older people, right, whom they live with because the situation is so precarious. And so with the work that you do with other departments, what then needs to be done in terms of there's nothing more liberating than being able to do your own hair, something that people take for granted, right? And it can be as simple as that. But some people actually offer themselves because it's that desperate. It's that desperate to get bread on the table.
There is a morality issue for me to assist that family, that young girl, in return for that I get sexual favors. It's just not a good thing. But number two, we would want to appeal to the school governing bodies because our relationship with the Department of Basic Education is so good. Sometimes you go to that school and that want to talk about and empower young girls, young boys, and then me and you, we are parents who just want to believe that my 16-year-old is not involved in sexual activity. Little do we know that they don't come and address this issue. We said, Mommy, tomorrow I'm going to start engaging in sexual activities. What do I do? So we must actually get out of this picture that tells me that my child is not involved in this activity. Let's allow space where the basic education can really rope us in and help to come and give some of these educating principles. But there's a higher health program pushed by the Department of Higher Education. We are invited into TVETs, into universities, and we are going to talk about campaigns we call Graduate Alive. Come in this university HIV negative, finish without getting HIV negative. We say first things first. The first thing that brought you here is a degree, a diploma. All other things should fall behind. And therefore, those campaigns, awareness campaigns that are really very strong in most of our TVETs and universities, as we are seeing some improvements on that. But that is probably those who have been successful out of high school. We need to catch up with these teenage pregnancies are just those who have finished primary schools and they're starting grade 8, grade 9. That's where we really see less empowered young girls, less empowered young boys, and therefore getting into this space. So let's get parents to allow us to really bring, through our school nurses, programs talking to these issues and empower and improve the level of understanding of our teenagers across the board in all our areas.
Dr. Dhlomo, the report by Statistics South Africa titled The Young and Restless, Adolescent Health in South Africa paints a bleak picture. It also speaks of disparities in medical aid access influencing the health-seeking behavior of adolescents. It points out that 9.3% of the black African population group had access to medical aid, the lowest group. Now, this ties in, I guess, with your explanation of the obstetric violence that we see being meted out to young girls by older nurses or nurses at public health institutions. And so is it safe to say, as the young children say, that they feel let down by the health department, that indeed the health department has failed these young girls because they're not able to afford private health care, speaking to South Africa being the most unequal society in the world, that if you can't afford medical aid, then this is what you deserve?
No, because of those dialogues, we are improving significantly. We have actually listened to the call of the young people. We are just saying to them, let them speak out, because in any event, there will always be private and public, but public, I mean, let's just give it, even on other issues that we are welcoming. There's about 1 million deliveries of women in our country per year. About 900,000 of those are taking place in public hospitals, only about 100,000 in the private. So private is always going to be smaller. So it means we can't push them out of public to private, because there's just not going to be enough space. So we need to improve what we do have. So through dialogues, we have been empowered by the Department of Health. And that is why I'm saying over 2,000 health facilities, clinics and hospitals have responded by providing a nurse. These young teenagers are telling us, provide us with a nurse, Dr. Dhlomo, not of your age, because those are nurses of your mother's age. Provide us with a younger nurse who we can converse and be able to express our feelings. So we are listening to those issues. And we think with that, we're going to see an improvement where we have youth zones that are actually headed by younger nurses, who these young people can actually engage easily. We do see that countrywide. I've been all over the country and actually seeing these clinics and getting young people to talk to us before, because we don't want to think we are having enough information to talk to them and talk down to them. Let's just listen to them and therefore be able to assist them. We are creating even what we call a demand for young people to come to our facilities. We are really getting Wi-Fi to our facilities. We are getting Wi-Fi to these other institutions that are just adjacent to our clinics, so that people can just demand to come there, and while they are sitting there talking, getting someone to assist them, they can do their homeworks, get to be on internet. So we are really creating a demand for young people to visit our facilities, because we can't push them out of our clinics and say the private is a space. Public should and must remain supportive, but we must create a very conducive environment as actually dictated by young people themselves.
Dr. Dhlomo, where are you going to be getting these young nurses from that you are promising these young girls who are coming to your facilities? South Africa does not have training colleges for nurses anymore. I could be wrong, but we've spoken to a number of nursing unions that are bemoaning that fact, right, that there's no longer training colleges for nurses. So where will these nurses come from, and how to retain them? Because some are also leaving the country for better pay.
Yeah, there's one issue to improve the number of nurses per clinic, but all we are saying for now to do is to go to that DAR clinic, go to Ikopo clinic, pull one nurse who's already part of them, and therefore give them this special training of youth user friendly. Let them go back after 3 weeks, understanding the attitude. So it's not like you are giving them a completely new training. It's a change of attitude and focus on young people, and therefore it's the same nurse who's part of the clinic, but then when they go to clinic A, the young people will now know that this is a youth user-friendly clinic. It has a youth zone. When I come in here, I must ask for Sister Susan, and Sister Susan is focusing on our programs. So it's the same. It's the same clinic where they get help, but usually we used to call it the happy hour. They come around 3 in the afternoon when they come from school or out of school. We focus them right until 5 o'clock. We can even demand even more time, but it's the same staff member pulled out of the pool, go to be trained, come back with the capacity to really do that work. It's just an added sort of tool within the same clinic that actually was providing service. That was what was unfriendly to the young people 2 months ago suddenly changes because of one nurse pulled out to go and get this training.
Dr. Sibongiseni Dhlomo is the Deputy Health Minister. Thank you very much, sir, for your time.